Ikwu Joseph. I'm a graduate of pharmaceutical technology. Also quality research and development intern from Enroll Pharmaceuticals Limited, Nigeria. I survey both research work on affordable health insurance for low-income Nigeria. It's just about understanding the willingness to pay and the behavioral drivers of the enrollment. How we see how people are willing to pay for health insurance in Nigeria at low income. So, so my background of my research is just about health insurance for low income Nigeria, covering Nigeria because Nigeria remains very low with 10 population of uh 10 population of the population of the health population being having low income in terms of health insurance and formal health insurance program. Most households tend to rely on out-of-pocket payment, which can create financial hardship when unexpected medical expense occur. Low-income household and informal workers, especially in Nigeria, particularly are very vulnerable because they often lack financial protection when illness strikes. So this behavioral economy shows that the people's decision about health insurance are influenced not just only by the price, not just only by the price, but how choices are being framed into their decision making and community behavior in terms of choosing a health insurance. So understanding this factor can help policymakers like governments and NGOs to design affordable and appealing insurance products that can increase adoption among the undeserved population, which are the low-income earners in Nigeria. Access to affordable health remains a very critical challenge and a major challenge in our low and middle income countries like Nigeria and low and income countries like Lagos and Ogun State. High medical costs often prevent individuals from seeking healthcare services. So healthcare services um, can reduce healthcare services in terms of health insurance can reduce the financial burden of hospital expenses, but enrollment rate remains very low due to cost concern, lack of awareness and trust issue because we tend to find out that most from health insurance programs or health insurance platforms are not legit. Some this for our country, Nigeria, some are not legit, some are full of scams. They tell you to invest a particular amount of health insurance. At the end of the day, you find out that that particular health insurance program does exist and going to close up after some period of time. So we need critical information when it is health insurance. So my research question for this particular research, what actually led me to this particular research, what made me actually choose this particular topic was it's the willingness for me to be able to pay a particular health insurance among low income Nigerians. How the willingness enrollment change as insurance prices increase? What is the proportion of the world of the population are they willing to pay at a particular price? How does some demographic characteristics such as age, income, employment status affect their willingness to enroll? What are the barriers that prevent people from enrolling in health insurance? One major thing is, let me take a case study of when I was in school. I was enrolled in a federal institution, so at least there's a percentage of school fees that goes to health insurance, NHIS, which whenever I fall sick, I tend to go to the clinic and I'll be treated. And then I notice there are some treatments that my NHIS as a student does not really cover. That's one experience. Then during my uh, NYC in Nigeria, I noticed I noticed that the health NHIS health insurance covered almost all less on severe health issues, almost all health challenge or health issues. Then after my service, I noticed I could no longer use the NHIS. And then maybe when I get it, I have to pay out of pocket. Then maybe I'll start calculating, oh, if I get to see it, I have to like fix myself in time so I don't get to have a heavy bill in the hospital, the fear and everything. So that's what actually made me choose this topic because I myself is a victim. I got sick at the point of time and I really needed help. I was low at financial touch, so I really needed the help. Have a health challenge. I really needed financial support, which I was end up not getting. I just had to like find another means and start seeking for funds and start seeking for financial funds from families and friends. That's actually what led me to this topic because this actually issue cut across every individual, every mostly low income Nigerians or middle class earners in Nigeria in terms of having them to have issue with health issue and them having that willingness to enroll themselves in health insurance. So furthermore, the method was conducted through a survey questionnaire and during our HPT training, we were able to understand how to structure our questionnaire to get meaningful insights about our respondents' demographic income, level, employment status, and previous experience with health insurance, and their willingness to enroll in an affordable health insurance. My study population is about 150 low-income adults aged from 15 to 18 and above in Lagos urban area and in Ogun State, which is a peri-urban area of Nigeria. So participants were recruited through various means at, which is shown on my slide: market union, community association, and informal health workers. So data collection was majorly done in an in-person structured questionnaire where I actually recruited two of my friends to help me out to spread out, get response from certain persons which are structured in our in line with my P.R.O.M.I.S.E micro lab request. And this survey included demographic information, income and employment status, previous insurance experience, and barrier to what could cause them not to enroll in health insurance plan. Using the hypothetical purchase tax with the HPT, people were asked the range of price from 560,000. So where response was recorded as yes or no, and we actually measured the estimation of how their willingness to pay and which will be shown shortly in a demand call. I hope my slide is moving as I progress.
Yes, yes.
Thank you. So my sample characteristics was I did descriptive statistics using the pivot table to analyze my data properly, which I now had variables of age distribution, employment status, and income group. So furthermore, most respondents were between 8 to 35, that's signifying a large population or large proportion of that age class. So my findings my findings on the P50 curve was about the demand curve for health insurance, the willingness for them to pay at the different price range. So I actually noticed, you can see the curve, you will notice the curve in between 60, the x-axis and the y-axis intersects here. You will notice the demand curve show a downward sloping relationship as health premium increases. As the enrollment price increases, you notice that people actually decline. The people actually decline. You have a downward sloping relationship. They actually decline when as the price increases, the willingness for people to pay declines. So you notice that at 10,000, at 10,000 people had a significant increase. At 5,500 people had a significant increase. Then at 10,000 people had a stable increase, and then down the slope at 15,000 started going down to the last 560,000 people had a very low low enrollment in terms of people tend not to enroll in such kind of exorbitant amount of money for health insurance plan. So that's showing the demand curve for the price willingness behavior. This chart actually analyze the behavior in terms of their willingness to purchase a health insurance plan within different specific prices. So the demand curve interpretation, the important findings I was able to understand that many respondents are willing to enroll at a very low price because they are actually earning low, and the demands drop steadily as the insurance price increases. And there's a critical price range where the demand declines sharply within 15,000. The demand declines sharply. So this actually suggests that uh, affordable health insurance programs should at least to keep premium low to high participation, to keep their prices for health insurance very low that a common Nigerian man will be able to afford. Because last I checked, the national minimum wage in Nigeria is 70,000 naira. So as such, you won't expect somebody earning 70,000 to put all this money to health insurance. At least you may end up person paying within that 10,000, 5,000. That's where you have significant increase. And during the analysis, I was able to deduce that at the rate of 10,000, people were willing to pay more. So this is my demographic table showing the proportion table of the livelihood and the the willingness to pay, which is here. The willingness to pay, you can see that at price zero, people were like, "Is this scam?" So it's actually it's had a little bit slightly, but people were like, "Is this scam?" or stuff like that. Like that's how Nigeria responds. You find out they respond the way they think. Then at price 25 at 25 naira, you find that people had a significant, everybody wants to pay because it's a little it's a little amount of percentage from their salary or from what they from their income. At 125, you will notice down the group at 50,000, 560,000, you notice there's a significant drop in the willingness to pay. Then when it comes to age, you find out that people who are older, people who are less than 25, and people who are less than 25 tend to have a low, let's say mid-level their willingness to pay for health insurance. Then people above 26, they are now still being exposed to health issues and they have a high willingness to pay for health insurance as well as employment status. We find that people who are employed full time and people who are unemployed, people who are employed full time tends to pay. People who are unemployed, maybe due to maybe some might be stay at home mom, or some might be into some business maybe they didn't want to specify. So they tend to like they would really want to purchase an health insurance, but they don't have the finance to pay for such. And as well as income level, you find out that people who earn the minimum wage, they are willing to pay for health insurance. And I noticed people who earn higher, they have a significant drop because they feel like, oh, since we have the money, so we don't really need to purchase a health insurance when our health breakdown, we can only pay at the go. So additional analysis shows across the group which are my demographics, which is the employment status, the income, and within the age range. So we noticed that employed respondents had willingness and the unemployed respondents had low willingness to pay. Then we find out that during income range, you find out low income owners, they showed interest at 500 naira because that's what they could afford. And high income earners shows a high significant greater willingness to pay. And then age group within find out that age within 18 to 35 they have more willingness to enroll for health insurance because they are getting older. They feel, oh yes, maybe we're getting older, so we're being exposed to health start being sick, start exposed to access to my all sort of disease causing illness, thus having them to have a backup plan of a health insurance. So this the age demograph, this is the demand curve. You will notice that the group A and the group B, that's the age from below 18, below 26, and below 26 is the blue, and then the above 26 is the red. That's the group A and the group B. The tend to group A have a high willingness to, that's the above 26 years old, had a high willingness to purchase health insurance plan. Then the below 26 has they were struggling and they had a very rapid down, rapid slopy move, rapid downgrade, slopy movement of they really don't really have much. They feel like, oh, you have family to cater for. I feel that's the reasons, or that will be some certain reasons that will cause them to not to see reasons to purchase health insurance plans. Then my key findings, both the group shows a downward demand trend as the price increase. We notice back to the curve. We notice as the price increases across the table, we notice when it gets to around 100,000 naira, everybody wants to like nobody wants to pay anymore. Nobody wants to pay anymore. Everybody starts like, oh no, this is expensive. We can't pay this. We can't pay this anymore. So that's where you find out that they have a downward movement. People like the willingness has started dropping. The willingness to pay for health insurance has started dropping. People no longer have interest because the prices has increased. You now notice that the health insurance price should be pegged at a significant amount within 10,000 to 15,000 and 17,000 naira, which is here 10,000 to 15,000, which is across the two intersect group between the X and the Y axis. You notice that is the price range where people are willing to pay for health insurance at most. So you find out that the older respondents, which are the above 26, demonstrate high willingness to pay compared to the younger generation, which are the group A. So the median willingness to pay, the P50 shows that within 8,500 to 10,000, we are about 50% of our population respondents were willing to purchase a health insurance plan. Then the demand dropped sharply after 10,000 when the younger respondents indicate a higher price sensitivity. Then my key takeaway for this actually for this age demographic is pricing the health insurance product should be around 85 to 95 for a common Nigeria and will capture most of the large population of the both age groups. So furthermore, we have I actually did a three demand curve. That's a multiple the price curve, the private price itself demand curve, then the age curve to actually see the how this the slopey a relationship between the groups. And I did for the employment and also I did for income as well. That's having multiple graph. I hope there's still more a little bit time for me to explain this through. So this is the graph. Let me take it quickly. Um, the key findings here, we find out that the group A, which are the employed, the group A, the group A, which are the employed, had a higher willingness to pay with a high demand. I actually did a little bit typo error here. Very high willing demand until they approach 9,000 naira, which they're like, the unemployed tends to like, oh, we can pay, maybe they get out of pocket cash and stuff. They are willing to pay within 8,000 to 9,000 naira at their expense for a health insurance plan, which and then the employed respondents was like they are willing to pay for health insurance between 9,000 to 10,000 range. So the P50 shows that the intersection between both groups are within 9,000 to 10,000, meaning if the health insurance plan is placed at this particular price, you will find out that the half of the population or half of the respondents were able to purchase very check and look at the curve. You will notice that both the respondents were able to purchase at a very high price, at a very affordable price, which is 9,000 to 10,000 for both groups. So if health insurance price is being placed at such level, it's able to take both the employed and both the unemployed respondent. Despite some people are unemployed and despite some people are low income earners, maybe they earn below minimum wage. So they may end up paying for such health insurance plan within 8,000 to 9,000, subsidizing it at a minimum reasonable amount of money. So then we go forward to our income analysis, where we'll now understand uh, how people react to willingness to pay for health insurance as their monthly income price. So we'll find out that people who earn from 0 naira to 49,000 naira, which are the group A, and then the group B, which are 50,000 naira and above. The 50,000 naira and above, that's the group B, have a high willingness to pay for um have a high willingness to pay than group A, which are the low income earners. That the P50 curve shows that group A can pay within 6,000 to 7,000, and the group B can pay within 9,000 to 10,000. So the demand drops sharply after 10,000. You notice the demand here drop sharply after 10,000 when the price increases. You will notice here, demand drops sharply after 10,000 when the price increases. When the price increases, you notice, and then down the group when as the price skyrockets, people tend to have low willingness to pay for health insurance. So demand drops, and it's a almost demand drop within it's almost 20% of the both population. So we find out that the group B, which are income earners, has a high more price tolerance, while pricing around 7,000 to 9,000 will capture and why health insurance plans being pegged at such amount will capture a large share of the overall market in terms of low income earners in Nigeria. So then, furthermore, that will be the end of our demand curves. Furthermore, I would like to during my insight, I was able to find out some key during the respondent, they were able to explain why enrollment during enrollment for health insurance plan they had a little barriers, such as like common barriers reported in my survey, in my research carried out was insurance perceived as too expensive. People feel like, oh, the insurance is expensive, lack of trust or in insurance providers. So people feel, oh, I hope it's not like one program that will open now before you know the next year or next 2 years. Yeah, the company has the health insurance has actually shut down. I know most of health insurance companies that existed 10 years ago and are no longer in existence anymore. From how to fold, from how to like fold into other companies. Um, like even some barely even stand on their feet. You won't compare recent health insurance like a common one in Lagos, I know. You won't compare like Stone Age, you won't compare them to Midway, you won't connect to Cardinal Stone, you won't compare them to Cardinal Registry, you won't compare them to First Registry. Even First Registry has been existing for past years for now. So furthermore, you're able to understand that some preference, they had preference, so let's pay only when we get sick, because the amount will not be too the amount may be too much. Some have limit, why most of them have limited understanding of how health insurance work. So in that need, we need to have this barrier highlight the need for proper education, maybe doing maybe a newspaper, um, online posts, social media campaigns, uh, um, market awareness, building, telling people about proper education about health insurance, the importance, and a simple health insurance plan that can start as a low-income earners in Nigeria and building trust initiative. Because when you do such, you actually build, when you bring out 10 good health insurance, you actually say, okay, yes, if you want to buy an insurance, you can go out and look at people, say, these are the people who are in the system, which you can actually purchase a health insurance plan, and they are authentic. They are authentic. So my major, going to the next slide, my major takeaway from this is actually the demand for health insurance exists. It shows that people actually the demand for health insurance actually exists in low income earners than what we think that, oh, because they are low income earners they don't want health insurance. This demand, this actually research shows that people really want health insurance because they find out that they don't want to like pay when they get sick, or maybe because by then when they get sick they might not be in their financial buoyancy at that particular moment of time. And then the demand shows that the demand is highly sensitive to price, and it actually shows a downward movement in terms of when the price increase. You notice when you take health insurance at a very high amount of money in Nigeria for low income Nigerians, they don't you can't actually get anybody to pay for such health insurance. We now notice that 5,000 during my research, I noticed that 5,500 is the monthly premium amount of health insurance that can be deducted from a low income earners in Nigeria. So this behavioral factor actually perceive that how she shows us how low income earners address health insurance, and it actually address trust and awareness barrier when people feel, oh, somebody's carrying out such insurance, oh, maybe government wants to do something, they feel, oh, this is a need for them to express their wants and their needs. So I feel going forward to my policy implementation, I believe that these findings will suggest that to policymakers like government and health insurance platforms and the nation at large and concerned Nigerian citizens, maybe they should develop a low-cost insurance package target at informal workers, target at low-income Nigerian earners, the people who earn minimum wage, and they should use clear messaging exercises and the financial protection. Tell them about like, yes, your money is safe, your health insurance is safe, you don't get closed up after a period of time. We are here for you. Give them the promises and show them validations of their promises. And then use partner with community or the organization like the town unions and the rest to build trust in terms of having a strong ground on health insurance in that particular society, such as Lagos and Ogun states. Then building public awareness about how telling people how I know most people might not really know how many of us, if not for the benefit of education, even despite the benefit of education, we might not really know how health insurance work until we get there. So this strategy could actually expand our financial protection and reduce healthcare related poverty. In terms of healthcare related poverty, if you reduce our healthcare issue, when you go to the hospital, you find out that everybody are sick. People have not even paid for hospital bed. The doctor hasn't started attending to them. How wish they had such health insurance plan. You find out that people come to hospital, they want the two, they think they are fine because they are being administered medication, being attended to because they had a health insurance plan for them. When they get sick slightly, they tend to go to hospital, and it improve our society health rate issues and it improve our national economy because when you get people sick, the economy derails and the health care suffers. So thank you for listening so much. Um, Thank you so much for the presentation and everything. Thank you so much, P.R.O.M.I.S.E Lab Micro Africa.